Now, the mouth is the perfect incubator for bacteria. It's warm, it's moist, there's an ample food supply, it grows very fast. Look at this slide. This comes from a scanning electron microscope. It was a sterile slide. An endodontist and a microbiologist teamed up, glued it into a 6mm pocket, left it there for 2 days to see what would grow on it. They took it out. This is it. Look how fast this grows. It's a fully formed biofilm covered in slime. If this grew in 48 hours, it's no wonder that we struggle with periodontal disease.
I have a pen here in my hand. You can put 10 million bacteria on the head of this pen. Then if you mechanically disturb them, they're going to grow faster than they would if they were left alone. If I mechanically destroy them or tear them up, they'll increase their reproductive capacity to divide every 15 to 20 minutes. How in the world can you control something like that? The way you control it is to control the environment in which it has to grow.
We don't have too many other choices. You cannot get down into a 4 or 5, a 6mm pocket with toothbrush, rinse, or floss. That's why the tray is important. The tray delivers the medication deep and it holds it there in place long enough to fight the infection.
One of the medical profession's major medical devices for treating disease is hyperbaric oxygen or oxygen under pressure. Oxygen under pressure is great because it's bacteriostatic. It helps the formation of new granulation tissue so that you're going to start healing. Oxygen under pressure also induces the formation of new blood vessels so that you get a regrowth of the capillary systems into this tissue that had been infected. The collagen is formed from your fibroblast is stronger when you're dealing with an area where you have oxygen under pressure. So really what you're dealing with the Perio tray is a localized hyperbaric chamber where we're delivering oxygen under pressure into that gingival sulcus or periodontal tissue. And now you finally have a way to get the benefits of oxygen down into this anaerobic environment, converting it to an aerobic environment so that we can begin to control that source of inflammation better than we've been able to do before.
In the beginning stage of treatment, you're going to be asked to use the trays 2, 3, or 4 times a day. And that is because each tray application is going to work against that bacterial community. So imagine it's like an onion, and you're applying the medication with the Perio tray deep into the pocket. You're going to peel off that onion. Next application, peel off the onion. Pretty soon, your body has a chance to heal because you're fighting that bacterial community. Then long-term use, for most patients it's 1 time a day, 10 to 15 minutes. Long-term use gives you a way to manage the bacteria on an ongoing basis. Not only is it impossible to get every bacterial cell out of the mouth, bacteria are constantly reintroduced into the mouth. You want a healthy oral flora, and this is what the tray delivery is going to be able to help you accomplish.